Okay, this is Abel. I'm going to be demonstrating oral hygiene on a conscious patient this time. I'm going to start with my hand hygiene. I will knock before entering. I will identify the patient with at least two identifiers, such as name and date of birth. I will put some gloves on. I will explain the procedure, what I'm going to do to the patient. I'm going to ask them how they normally do it. If they want to do whatever they'd like to do, I'll allow for them to do it. If they do it on their own, that's a good time to watch them and see how they're doing it. Make certain that they're doing an adequate job. Make certain that they know how to properly do it. I will gather all of my supplies up, which I conveniently have here on this table. If the patient, well, before I do anything, I'll go ahead and inspect the patient. They're conscious, so I'll ask them if they have any trouble swallowing. If they say that they do, then I'll definitely double check their gag reflex. I'm going to go ahead and check take a look in their mouth. While I do this, I can also, if I go deep enough, I might end up assessing their gag reflex. If they don't gag when I put it in at all, then I'll take note of that. Maybe then I'll really check their gag reflex, but if they're like me, then gag from anything. I'll check all surfaces of the mouth, under the tongue, gums, making sure not to actually stick my finger there. This is hard to move rubber. So I'll definitely use the tongue depressor to get a good look at all the surfaces of the mouth and make sure there's no lesions. I'll look for dental caries. I'll look for thrush. I'll look for redness, white, anything that just doesn't look like it's as healthy as it should be. Gingivitis, periodontitis, any of that stuff. Take a good look in there. If I smell anything out of the ordinary, then I'd also note that. If I saw any signs or noted any signs of infection at all, I would take note of that. If I've done that, I've finished examining the patient's mouth. I take note of their breathing. I don't have to auscultate their lungs since they're conscious, and if they're not having any signs or symptoms of pneumonia, of aspiration pneumonia, and they don't have any trouble swallowing, then I don't have to auscultate their lungs like I did for the unconscious patient. Although, I guess if I was going to be overly cautious, I could go ahead and change out, get a new set of gloves for the actual tooth washing. For this part, go ahead and keep suction handy. I'll go ahead and do that. I'll keep this suction handy that I had up there from before. This is actually a brand new one I just put up. You just couldn't see. Anyway, I keep a suction handy in case I needed it. I mean, if they're able to spit, then you probably don't need it as much as you would with the unconscious patient. Go ahead and pull that down. I'll put a chuck or a towel. Go ahead and do a chuck right here just in case there's any that goes down on them. Anything falls out of their mouth, it doesn't get them dirty. So go ahead and got that chuck there. If they are, I'd ask them if they have any dentures. I'd ask them if they have any sores in their mouth, anything that they're concerned about with their mouth. If they have teeth, then I would go ahead and put toothpaste on the toothbrush, and I would go ahead and brush the teeth. The chewy surfaces, not using my fingers as much as I kind of just did that. I wouldn't use my fingers. I would, if I needed to move the mouth. Honestly, I kind of don't think I need to as much as I do on this dummy because he's so stiff. But I try to get the interior surfaces first of the upper and lower teeth, and then I would try to get the front surfaces of the teeth. And then I would brush the tongue, being careful about the gag reflex. If the patient started to gag, I would be careful about that. You know, no one likes to gag. After I brush the patient's teeth, I would have a little bit of water in here. I'd let them take some of that water into their mouth, and then I would have them spit it into this basin right here. Wow, shoot this. Just lowered, and I should have raised up the head at the beginning. Just position them more comfortable, because who wants to be all laying back when you're doing this? They'll be a lot better able to not aspirate if I have them positioned up high, and this way I'll be able to access them better. Okay, there, that's better. I mean, he wasn't going to be able to spit nearly as well. Okay, he spits that out now. If he had trouble spitting it all, I'd just suction it out. And now after that, I can, if they have mouthwash, at the beginning I check the chart for this patient just to check anything going on with their oral hygiene, oral care. This mouthwash, if they have it, it's going to belong to that particular patient. It's going to be allocated to that patient. So I would use a med cup. I'd put some of that in their mouth, and I could either do this for them if they would like that. I could floss for them if they'd like that. I could have them, after I've had them rinse it a couple times, I could have them spit the mouthwash out. But yeah, I can do this rinse twice. Like the first time, give them a little more. After they've done the first one, have them spit the second one. Then I do the mouthwash. If they had trouble doing anything, I would do it for them. If they'd like to do it, I'd allow them to. And then when I'm finished, I would go ahead and remove this and put that back up and raise this bar back up. And I would reposition the patient. To the lower setting. If I had anything that I had to clean here, I mean right now if I'm doing disposal, I'll just grab everything I'm disposing of. The suction I dispose of, this thing I dispose of, the toothbrush, the MSS pin, pretty much all this stuff is disposable. But if I had anything that I needed to clean in particular, then I would switch to a new set of gloves to clean it. And I document any findings. I would document that I did the procedure. Document any findings, document the procedure. I raise the thing up, and I think that's all I could think of. If I noticed any coughing, I would pay attention to that, because that could be a sign of aspiration. Offered flossing. If the patient had any problems with their mouth or with oral hygiene, I would document that, take note of it. If they had any lesions, I'd document that. Yeah, that's all. Then I would let the patient know I'm finished, and after I'm done, I'd ask them if there's anything they needed, if their mouth felt clean, and then I would go ahead and make certain they're warm, and I'd leave the room.